Guys, welcome back to Medical Coding with Blue. It is Christmas in July. We are on the final edition of Christmas in July. This is the rheumatology specialty. If you've joined me the entire journey this month for Christmas in July, thank you guys so much for viewing, for tuning in. And I hope that all of these web links that I've been leaving on all the description boxes will help you to better understand these specialties. These are some of my most favorite specialties. And of course, I'm going to round it out with my final favorite, which is rheumatology. And rheumatology is related in a way to orthopedics, so this is why, probably why. But like I said, I will be leaving these links down in the description box below, and I'm going to read some of what these web links are talking about as well. When I was learning about rheumatology and the things that I was going to see there and what procedures I was going to come up against, I really took the time to read as much as I could, because this clinic needed somebody that was going to be as detailed. They have a lot of conditions going on, these patients that see rheumatology. There's a lot of autoimmune conditions that are being seen there in that clinic as well. So the definition of what is a rheumatologist treats joint disease similar to an orthopedist, probably why it's one of my favorites, but does not perform surgeries. Common diseases treated by rheumatologists include osteoarthritis, gout, rheumatoid arthritis, here again with our arthritis, chronic back pain, tendonitis, and lupus. So what is lupus? As my favorite TV doctor, Dr. House, would say, it's not lupus, or it's lupus, or are we sure it's lupus? Where is Dr. House now? That's what I would like to know. Where is Dr. House? Can somebody please get him and his whiteboard out? But what is lupus? So lupus, SLE, can affect the joints, the skin, the kidneys, the blood cells, the brain, the heart, and the lungs. Symptoms can vary from fatigue, joint pain, rash, and fever. These can periodically get worse, flare up, and then improve. While there's no cure for lupus, current treatments focus on improving quality of life through controlling symptoms and minimizing flare-ups. This begins with lifestyle modifications such as sun protection and diet. Further disease management includes medications such as anti-inflammatories and steroids. It is so important for you guys to not only understand what the disease is, but to also understand the treatment options. Now, if you're thinking, why do I need to learn the treatment options? The treatment options are going to help you, because then you're going to know what you're up against. I didn't know that any other clinic besides ortho did joint injections until I got a hold of the rheumatology clinic. Then I saw that they were doing injections as well. So I was like, oh, okay, well, let's all get on the same page here. And so let's do a little bit of improving. So it's just very interesting. So that is one of the things that you need to be aware of. Also, with some of the other things that they talk about, they have on the lupusresearch.org website, it is very helpful when it talks about like what are some of the treatment options, all right? Now, your rheumatologist at your facility may or may not deal with this. It may be somebody else, or they may be sent to another clinic, or whatever the case may be. But in case they do, so some of the treatment options that they have for lupus is like NSAIDs, antimalarials, corticosteroids, immunosuppressives. So those immunosuppressives, I've been telling you guys to learn and know the difference, because when you're coding for things like chemotherapy, you may have to know the difference between chemotherapy and immunotherapy drugs. So this is why it's important for you guys to know and understand these things. And that's why I keep pushing you guys to look up those things. Different types of inhibitors, the BLYS specific inhibitors, they use that. And then they use related medications. So sometimes they will prescribe medications for the patient that are injectables, okay? Those are parenteral medications. And if you look on the evaluation and management tool, right? And I believe the one for, gosh, what is the name of that? Oh, I forgot the name of the website. There's a website that has the, how did I forget the name? Anyway, the evaluation and management tool, in the high complexity box, it talks about parenteral controlled substances. that's when you have to know what the difference is and when they're prescribing these medications, because sometimes they'll give these patients, not necessarily for lupus, but for other conditions like rheumatoid arthritis, they'll be giving them injectable drugs. So you need to know what the difference is in the two, okay? Understand what it is. If they're saying that they're prescribing this medication, make sure you know, is this a pill form? Is this an injectable? That is what you need to focus on, because when you learn those things, then you'll know what the medical decision making is, because there's a difference between moderate and a high. What is going to fall into that risk category? Which risk category is it going to fall into? So that is something to keep in mind. Now, what does parenteral mean? Parenteral drug administration means any non-oral means of administration, like injectables, okay? I'm not talking about insulin. That's not insulin, okay? don't think about that, okay? But it is generally interpreted as relating to injecting directly into the body, bypassing the skin and mucous membranes. So that is something that you have to be aware of, okay? So that is something that I learned. And that was a source of an argument, if I'm being honest. That was a source of an argument with my supervisor. So that was it's a very interesting one. An argument that I won, nonetheless. But it took research, because that one, it was just like, no, that's just regular prescribed medication. No, they have to actually monitor that, and they have to make sure they do it right. So I'm just saying, that is something that you do have to know when you are learning about these different medications. It's going to help you, especially if you have to, if you're using it in your argument to support a level, okay, a level choice. Now, of course, evaluation and management is going to go through a change in the coming months, but it's still important to understand what you're reading now, okay? It's always going to be important, doesn't matter what, okay? It's always going to be important, because if not, then you may be missing different diagnoses as well, like the long-term use medications, if you have to pick those up. And some of the there's another helpful website called ibji.com. It is a Illinois Bone and Joint Institute. They have a common list of diseases treated by rheumatologists. So they have Sjögren's syndrome, scleroderma, dermatomyositis, polymyositis, polymyositis. I'm going to get it right. And then polymyalgia rheumatica, septic arthritis, sarcoidosis, another favorite diagnosis from Dr. House, gout and pseudo gout. And then they talk about the different autoimmune diseases, okay? So while the rheumatologist may not see all of these conditions, it's something to be aware of, okay? Gout and pseudo gout this is very interesting, so I want to read this to you. Gout and pseudo gout are very similar. Both are caused by crystals forming in the joints. In gout, the crystals from uric acid, and in pseudo gout are formed from salt. Both can display symptoms that usually affect the knee, the ankle, or the big toe. The symptoms include joint pain and tenderness in one or more joints, arthritis, joint swelling, and fluid buildup. Okay, sarcoidosis, if you don't know, sarcoidosis may not display all symptoms, but may cause achy joints, fatigue, chest pain, rashes, hair loss, headaches, vision loss, nosebleeds, and many other symptoms. It occurs when clusters of immune cells. I'm going to talk today, okay? I swear. It's just because I'm trying to rush. That's my problem right now. Sorry, guys. It occurs when clusters of immune cells form in the skin, lungs, liver, eyes, lymph nodes, and other tissues. So, very interesting stuff. And then, of course, septic arthritis occurs when bacteria like Staphylococcus or Streptococcus moves through the bloodstream and invades a joint, usually in the hips or the knees. Commonly, the symptoms appear very quickly in only one joint and include swollen joints, fever, extreme joint pain, and diminished ability to move the affected joint. So not cool, you know. Polymyalgia rheumatica, the inflammatory disease, polymyalgia rheumatica only strikes people over 50 years of age, causing tight and painful shoulders. The patient may also experience fever, anemia, and fatigue. So it's really interesting when you get to learn all of these. And one of the other websites that I have found that I'm leaving for you guys is got a list of all different types of rheumatological conditions as well. So this way you can make sure when you're looking at the documentation, if you're working in rheumatology, you can look at the documentation, you could be more confident in what you know, and you're confident in your understanding. It is advanced because it's not just one thing. These are conditions that affect the entire body a lot of times. You know, when you're talking about treating chronic pain, or you're talking about treating like rheumatoid arthritis and things like that, these are conditions that it impacts the entire body. It's not just one system usually. It's attacking multiple systems. So this is something that's, if you're ready for a challenge, it is really a very interesting thing. And one of the doctors that I worked with, this was like her second assignment at a facility, and she was just very like, it is just a lot. It's just so much. There's like, it's not like just one thing that they can test them for. They can run tests for many things, but trying to nail down their symptoms, because their symptoms sound so much like a lot of other conditions. So they really have to work with these patients, which is why their evaluation and management levels need to reflect that work, and it reflects their medical decision making as well. So if you are working in rheumatology, make sure that you're looking carefully and make sure that what they're doing is documented fully, okay? So that is just my thoughts on that one. And yes, it may be a little bit more work than like something like cardiology or neurology. Those two are still a lot, but rheumatology is a lot as well. And I can't actually pin it down into like a single, this section covers this. It covers in a lot of different sections. So that's why I didn't do like that. So that's why I try to give you guys a list so you guys know what to what to go up, you know, and look for. All right. So I hope you've enjoyed this. I hope this made sense, and I hope I didn't talk too fast because, like I said, I got home a little late and I have to get this up and loaded. So hopefully it'll be up and loaded before 6:30 so you guys can enjoy it tonight. Enjoy the ad-free content today because this is not going to have any ads on it. So enjoy it. My gift to you. So happy Christmas in July. Hopefully by Christmas, we will all be somewhat back to normal, or at least partly back to normal. I don't know. We'll see. So anyway, I will go ahead and close this one up. But if you are a medical coder, a medical coding student, somebody curious about the fascinating world of medical coding, a provider or a nurse, I invite you to like and subscribe and follow me on my journey in medical coding. I will see y'all in a little while.